Dr. Peter Montgomery, family practice doctor here, and doing my COVID update and to give people some information on tracking. Everybody's tracking different numbers, and I'm going to let you know how I track things that may give me and hopefully give you some perspective on where things are going and what we can help us again deal with the fear. If you have an idea what's coming, what's dealing, the best way to deal with fear is preparation and to have a plan to discuss with other people. So I'm going to discuss this with you. There is a whole field of epidemiology, whole mathematical statistical science of tracking all kinds of things. And the CDC is our specialist at that. And they have been tracking the flu for decades and are very good at it. And they have a map of it, but one of the best ways to look at it is a graph here. And so I'm going to kind of show you this: the flu cases this year, as reported from the laboratories, of positive tests that have been turned in. Not everybody with the flu has a positive test or even shows up with the test. But of the tests, you can definitely get a trend. There's flu A here. I'm highlighting it. You got flu A, and then there's flu B. Both show up, and how many of the tests were positive. So what we noticed is that there was a big spike. B spiked first, and from 500. I wish I could get this to behave a little better, but here where my arrow is, about 500. Suddenly jumped to 1,000. It doubled in this weekend, and this is about the weekend around Halloween. Again, lots of parties, people spreading things, and then we get a big spike in B, and then went up by another 500 cases, up by 1,000 cases, up by another 1,000, and finally peaking right here the week 52 of year 2019. So by the week after Christmas, 11,000 cases. And so, just a real peak there, and it's finally been coming down. So we're right now actually back to the Halloween numbers. So a nice wave and coming down. And actually, for the first time ever, I got the flu this year, and I got flu B, and I got it right about here, and it sucked. But the vaccines usually work, and general methods of avoiding the diseases work. 25 years of people coughing in my face, I think that's a pretty good track record. Flu A got a slower start. Took to about here to get to the Halloween numbers, so that was trailing by about 4 weeks, and didn't really get to a good rip-roaring pace here till around Valentine's, and the week there and has peaked and is coming down. So our flu count this week is equal to about New Year's, around the time around New Year's. So it's raised and peak. And again, so that's about a 6 weeks raise when it got really going, and then 6 weeks down. And that's kind of normal for viral illnesses. So there's lots of other websites out there that are tracking things. There's the another one I like to show is our tracking of the testing. A lot of people have seen the Johns Hopkins really cool dashboard of the world, and that shows some interesting information I'll show you in a bit. I'm trying to show you something a little bit different. I'm showing how hard we're working at this. This is the total number of tests we're doing each day. Positive tests, negative tests, the total. And how many tests have still not yet been processed. There's still a bit of a lag on there. And the lag has jumped up a lot, from a lag of 2,000 to 3,000 all of a sudden to 14,000, because we are testing a whole bunch more, overwhelming the sites, causing a bit of delay. But it's a sign that at least we're getting the testing done. We'll get the processing caught up with the testing. There was an increase there looking over here on the far side of the total tests, about 20,000 tests, then 30,000, then 50,000 more, and then again, 50,000 more, and then almost 70,000 more, and now again over 60,000 more tests a day than the day before. So we are definitely ramping up testing in this country, and that will all start giving us a more true number. We're going to see a number of cases pop up here soon. Not so much spread, because I'm going to show you another chart that most of the spread's already happened. And most of the mild cases already happened because people don't know it happened. But the people testing are the people who are sick. So I think the sick people are coming in more, and we're testing more. Then we're going to get a more accurate number of the people who are feeling sick who are actually positive. And why did I say, what do you mean there's already been a trend? There is a company called KInsa. They make a online thermometer. You can check your temperature, and it'll put it on their map and database. And it's actually been able to predict the flu swing, that flu wave that I mentioned before, about a week or two before the CDC data says, hey, something's going on there. And so, so here's their website, and they've got their map. And this is a map that has, they look at a couple different things. Atypical, in other words, where the temperatures are higher than previously there for that day the year before. We see a whole bunch of red here in Florida, and oh yeah, spring break. Spring break kids happen on the coast. It's not happening in the center of the state. The spring break kids are spreading disease, and they are spreading many diseases. If you ever been on spring break. And so they're having more fevers, and sadly, they're now going to take that back to other cities. But those numbers definitely up. Here's the spring break along the coast of Texas, also not quite as bad as it was in Florida. Then they also give a map called Observed. These are the actual temperatures, and above average, so definitely more red than average. There's a big swing here from Louisiana up through to Michigan. And you can zoom in. You can zoom in even by county. Zoom back out. Here is New York, New Jersey area. And if you're watching the news, they're having a big spike of COVID cases. California, where it is next, and they're orange. They're not quite getting into the red yet. Interesting, though, is the trends are on the way down, which gives me an impression that a lot of people have been sick. Now, these are all fevers, not just COVID. So the flu trends are going down. So I think this is showing us the decrease in the flu cases. The people are like, oh, the COVID's passed. But you can say, well, this could be the flu cases going down. Now, over down here in the corner, they give you kind of a trend. So, yes, we had a big spike. It's going down. I'll scroll down a little bit more. You can kind of see the dates, and that correlates with our tracking of influenza A going down. But I think this one, if you click over here in it, atypical, in other words, this is not typical. This is not normal flu. This is an increase. I think the atypical on here gives us a better look at the COVID infections going on the rise. And this is infections going down in general, most likely the influenza cases going down. And observed is what's actually happened, just the raw data of the temperatures. It would be interesting to watch this over the next couple of days and see these red areas and see if they turn into atypicals over the next few days, or if also the trends, see what happens. If the trend here reverses in LA from a dark blue to a light blue, then something's actually picking up there. And the observed should probably then go from orange to reds there. And then also then start showing up as more atypicals, because that would be unusual. The flu season, it should be going away. Why are fevers going up? That is atypical, not the typicals. The typicals, the flu and everything going away. So that's several ways to track it. I've actually liked the old Wikipedia, the high school report writer's friend, and they do a very good job of breaking down the infections country by country, cases, deaths, recovered. And they give some different graphs I haven't seen in other places. And I do like this graph over here. This is China. And we can look at this as historical because they have evened out. Things have reached a steady state. So this purple line here, this thin purple line, is the number of cases. This is how many cases they, testing actually. And then it dropped off. But after the testing number dropped off, the actual sick people, so a lot of people were sick who never got tested. So this is the people actually showing up sick is the yellow line, and the people actually in the hospital. So hospital admission, testing. So the testing predated the actual people getting sick. There's about a week or so gap from being tested to getting sick. And then there's a gap, and of course more people are sick than were tested. And then it dropped off. And from when things got really noticed about January 1st, way off the map, when really things started picking up about the middle of January, there's about a 4-week to peak and then dropping off. And the blue is the recovered, and actually this number is that they put the recovered on top of the sick on top of the people who died. The death rate has evened out. People are leaving the hospitals. They've shut down their 14 emergency hospitals they built. They're all been shut down, and they're back to what their system can handle. These are the people recovered, immune, no longer spreading the disease. So that's a trend each country will individually go through. It's just where are they at on that trend. And so you can go back, clicky, and pick a country. Now, sadly, here's Italy. They are currently doing very poorly. They don't quite have the same exact chart. It'd be nice if every country had the same chart looking at you, Wikipedia. But we can see a similar trend. This is the number of new cases. And Italy seems to have peaked. And we can go back about 4 weeks, 3 weeks to March 1st, about a week before that. Yep, 4 weeks. It really started getting going. 4 weeks to peak. And now it's coming down. The recovery, that would be the blue, start building up. Sadly, the death toll seems to linger on quite a bit longer. As I show you some of the maps, it just seems to hang out there a bit longer, but it stops peaking. We're steady rise. I'll show you the St. Johns Hopkins map. A lot of the states, if you go by individual states in America, we're all in this steady rise phase of all these numbers, but then there is a peak at about 4 weeks. It's just over and over. Pouring over this. South Korea got it pretty quickly after China, jumped all over it, did their best to calm it down. And February 1st, it's kind of like off the map, but it's pretty soon up there. They were about 2 weeks to peak. If you kind of go about February 14th to February 29th, the 31st, March 1st, they're peaking down. Now, they really cracked it down. They had a different situation where a church and a huge group of people got it all at once, and then they shut the system down and did their best to control it. The deaths are lingering, but they're not steadily going up. If you take the average of the good days and bad days, the trend is going down slowly. Number of active cases, again, peaked a bit, and is dropping. And again, that's about 4 weeks for when it starts showing up. There's a drop there in the active cases. And they have a track here of how many they're testing. They're still testing, around 10,000 a day. The testing has dropped off as less people are getting sick, less people are worried about it. Let's come over here to the another country that's had a bit longer, Iran. No chart on them. We're not quite getting the same level of data from Iran that we are getting from a lot of other countries, making that harder. Germany, just north of Italy, over the Alps. And they're still on the new cases spiking. The deaths are spiking. They're still getting that straight line up. They haven't hit that peak. And it's a pretty sharp peak. When it starts going down, it starts going down. There's and so based on my 4-week, they got started here in March 1st. They got about another week to peak. Okay. Let's bring us back to the United States. we're so United States Central. A lot of scrolling, lots of news. They throw all the news stuff in here. Thank you very much. Thank you very much. And here's our number, pretty much a straight line up. And when it hits a peak, then it'll start coming down. And these are the people being tested. The number of cases, we had a day down, but again, our testing is just ramping up to large volumes of testing. And it's state by state. We're 50 states, 4 time zones. So I think we're going to see a bit of a different pattern, but really things really got going about mid-March. Here's March 15th. March 1st might be a number you want to go by. The first time we got some double digits. So 4 weeks to peak. I think we got about another week to peak also. And then things start calming down. And the death rate is picking up. We're in the hundreds a day now steadily. And that number lags after the peak drops. The deaths keep adding up because people are in the hospital for about a week or two after they get sick. Or they take about a week to get into the hospital, and then the hospital about a week, and they either recover or don't. Some therapies are improving. That is getting better. So on the news, the president says, "Oh, things will get back to normal." April 15th. We should be past our peak by then. Psychologically, people when they're going to feel the sense that the peak is past. The news is going to change about that time. He's not just making up a number or wishful thinking. That seems to be the trend, about 4 weeks to peak. And then probably another couple weeks for us to realize it, for us to, get caught up. The hospitals are still going to be swamped. We're still going to be at max capacity. We're still going to be trying our best not to ration care and give everybody the full care. All the people who are sick, there's still people coming in with heart attacks and gallbladder attacks and strokes and car wrecks, and they need to be taken care of. Our hospital system has to be able to do all of it. And the system I'm at, they sent out a survey out to every single doctor saying, what can you do? And every doctor I know said, whatever you want. I have some pregnant colleagues, and they're like, can I just do telemedicine? And we're like, yeah, cool, great. And those who can go in the hospital and help out and relieve the ICU doctors or relieve the doctors who are taking care of the other cases that they're familiar with doing. Everybody's going to be pitch in so we can handle that swarm of cases. New York City's calling for new ventilators, and they're being built. I heard an interview on NPR by a company that makes ventilators. It goes, we normally make 100 a month. We can make 1,000 in a month, and if you give me a little bit more time, I can make 10,000 in a month. And we're like, and the interviewer's like incredulous, like, come on, like train all the people. He goes, yeah, no, we can totally do it. Our supply chain is totally solid. And he says, we got enough people, and in making more ventilators. That was just one company. They are on it. There's many ventilator companies. And then she's like, well, what about all the people to run the ventilators? Well, we got a lot of people run the ventilators, and this guy's company says, I feel embarrassed here. I can't remember the name of the company. But he goes, no, ours is meant that we can train a parent how to run a ventilator for their kids at home within an hour. And so they're very easy to use ventilators. So I applaud him in their effort. Some factories are being converted from stop making cars to making ventilators. In World War II, hey, they made tanks. And they converted them very quickly to making ventilators. Is something they got manpower. They got people who are very smart and can put things together. And all the engineers, and they've already been built. They just got to move the facilities in there. They're going to help out. So I applaud all these companies that are pitching in to meet the crush of a ventilator need. And those ventilators might be moving from one state to the next. This is a wave. It sends a hit on the coast and move to the center. So hopefully we have time to get ventilators built for everywhere, and they're no longer needed in one place. We can move them to another. I think our healthcare system is up to this challenge, and it will be a very difficult challenge, but everybody I've been talking to is working fantastic on it. I will then go to the Johns Hopkins World Tracker, where you can get a breakdown state by state. This is the worldwide number of confirmed cases, deaths, and people recovered. And here is the world graph. The world is currently in the up. We have not hit the peak. And breaking it down, they got the countries here like I was showing you in the other maps. When it comes to the U.S., they were breaking it down by state. And has something changed since the last time I looked at it? Before I was looking over here and be able to see New York separately broke out. But you look at the countries, U.S. and this, doing the straight line up thing. Here's Germany. Here's Italy. Everybody's got the straight line up of new cases. We all have not peaked yet. Here's China. This is what everybody's doing. They did their straight line. Actually, at this time, this weird number is the World Health Organization came in and said, actually, here's a more accurate way to do the numbers. You've been doing good. Actually, this is more useful. And about that time, there was a smoothing off shortly after that, because that was the 4 weeks to peak thing that I've noticed. Flattening the curve, can we make it 6 weeks to peak? The slower we take the peak, the better. 6 weeks to peak is even better. 8 weeks to peak is even better. I think the country that takes the longer time to peak their cases did the best job at social distancing. So keeping 6 people away from you is good. Mask and goggles if you're out in public would seem excessive. But if you're someone in a high-risk category, I would salute you for your forethought and extra work. And if you can give those people extra space, they're basically saying, I would like a little extra space. U.S., when I click on U.S., it does give us a breakdown of deaths per state. I'm going to scroll down over here, see if I can get cases per state. And they seem to have quit doing that unless I click another thing. So I'm out of my depth. I did not expect that change to happen on the program. But that seems the way I've been tracking cases. I got my little thing where I've got all the things I've been doing, the tracking state by state with how many tests, the Johns Hopkins tracker, the Wikipedia tracker, and the fever tracker kind of gives me a trend for things. You watch them, looking at it one time, you go, what? But you follow a tracking app or a tracking program for a while. After a week, you start to get a picture, and after 2 weeks, you're like, okay, I get this. So this is my little thing I'm letting you see is, all the websites. When I find something interesting, I bring it on here, and I got it broke down by diagnosis, testing, prevention, tracking. Prevention again. The doctor up at the University of Minnesota, Dr. David Boulware, him and his team are testing to see if hydroxychloroquine in a placebo-controlled trial can prevent people from getting it. And again, all this information is very useful because we want to avoid the last thing in tracking. The thing that is keeping my attention is the 3-wave attack of the Spanish flu in 1918. That was the little wave in the spring. I would hate to think this is the little wave. It calmed down over the summer, but there was a mixing pool called World War I in Europe. And the virus mutated into a more quicker, deadly form, and the biggest wave hit in the fall, starting in September, with the most deaths happening in October, then dropping off, and then another very big wave, technically, hit again in the spring again in 1919. So we have a chance to ride this wave out and prevent this wave. I think the studies in prevention, learning about treatment on it, and canceling the Olympic Petri dish. That is a horrible mixing of germs every year anyway, every 4 years, and this year would be terrible. They need not to be going out there and encouraging generation of new germs and mutations and spreading it out. So I think that would be the wisest of all decisions, to cancel the Olympic games this summer in Tokyo. Don't mean to be rude calling it a petri dish, but that's what's going to happen if that happens. I think by avoiding that, we avoid this second terrible fall wave. We'll have better treatments, and that's the test: is that we don't forget this. And June's going to come along. We're feeling a lot better. July, we're going to go, wow, that was crazy. September, we need to get our guard back up and be very diligent on working on this and be emotionally and psychologically and physically and financially prepared to prevent this or ride out any other kind of wave that might happen seasonally with this. So that's my thoughts on tracking when I'm thinking about tracking any disease, influenza or the COVID. It allows you to have a crystal ball, a little bit see in the future. I've been saying things to people like, how'd you know that was going to happen? I've been tracking this since January and making decisions based on that, and this has been very useful. Not paranoia. This is not fear mongering. This is looking ahead, reading weather reports before I go out camping. I was in the Boy Scouts. We really looked over um, the forecasts in detail before we went out camping. And sometimes we even cancel or say, we're going to do an indoor camp. We got a place, I always had a backup, someplace we can go where they can still do something educational. So checking the weather forecast before things, perfectly sane, sound, good parental behavior. So this is not paranoia. This is preparation. So that's what I do for tracking. And I'll put those websites on there if you don't know those already so you can track them yourself. Don't freak out in any one day. You're watching trends and trying to predict where the trends will go so you can make smarter behavior. And again, we flatten the curve of all these by social distancing, which is the waving part. So we all need to be doing this, washing our hands, waving, social distancing, wiping down surfaces because it can live for long periods of time. So, to cut down spread there. And whoa, don't touch your face, eyes, nose, mouth. That's how it all gets into us. Thank you for remembering the 5 W's to stop the coronavirus, and I'll do another video tomorrow night. Thank you.